Have you ever noticed your leg hair thinning or disappearing and wondered whether it's something to worry about? Today, we're looking at what can cause hair loss on the legs, when it's worth getting checked out, and what your doctor can do to help. So first, a bit of context. Leg hair loss is actually quite common and it becomes more frequent as we get older. Most of the time, it's completely harmless, but occasionally it can be a sign that something else is going on, and that's worth knowing about. Let's start with the straightforward causes. As we age, hair follicles naturally become less active, so leg hair can gradually become thinner and sparser over time. Entirely normal. Friction is another simple explanation. If you regularly wear tight socks, leggings, or trousers, the rubbing against your skin over time can cause localized hair loss in those areas. And hormonal shifts, whether from changes in estrogen, testosterone, or thyroid hormones, can also affect how body hair grows. Hair growth itself follows a cycle: an active growth phase, a transition phase, and then a resting and shedding phase. When something disrupts that cycle, hair can stop growing properly. One of the more clinically significant causes is peripheral arterial disease, or PAD. This is where reduced blood flow to the legs means hair follicles aren't getting the oxygen and nutrients they need. It's worth saying clearly though, hair loss alone doesn't diagnose PAD. It's one possible clue alongside other findings, and it needs proper assessment by a doctor. Hypothyroidism, an underactive thyroid, can also disrupt the hair growth cycle, leading to diffuse body hair loss, including on the legs. The same goes for hypogonadism, which affects hormone production. Diabetes is another condition that's been linked to leg hair loss, and occasionally, dermatological conditions like alopecia areata or a fungal infection can affect leg hair too. Nutritional deficiencies can play a role as well. Iron deficiency anemia in particular has been associated with hair loss. Certain medications, including chemotherapy agents and beta blockers, can also cause leg hair loss as a side effect. So if you've recently started a new medicine and noticed changes, it's worth mentioning to your GP or pharmacist. Now, you might have heard that biotin supplements are good for hair. It's worth knowing that the MHRA, the UK medicines regulator, has warned that high-dose biotin can interfere with certain laboratory tests, including thyroid function tests and cardiac troponin tests. So routine biotin supplementation isn't recommended, and you should speak to your doctor before taking it. So when should you actually see your GP? If your leg hair loss is sudden, patchy, or asymmetrical, happening on one leg but not the other, that's worth getting assessed. If you're also noticing skin changes or experiencing pain in your legs when you walk, those symptoms should prompt a fairly prompt GP appointment, as they could point to a vascular cause that needs ruling out. If you wear medically prescribed compression stockings and you're worried about friction from them, please don't stop wearing them without speaking to your GP or nurse first. In terms of investigation, your doctor may arrange blood tests to check thyroid function, iron levels, and blood glucose. They might also measure something called the ankle brachial pressure index, or ABPI, which helps assess blood flow in the legs. Depending on what they find, they may refer you to a dermatologist or another specialist. Treatment will depend entirely on what's causing the hair loss. If there's an underlying condition, whether that's a thyroid issue, a circulatory problem, or a nutritional deficiency, addressing that is the priority. Your doctor will guide you on the right approach for your situation. To recap, leg hair loss is often benign and related to aging, friction, or hormonal changes. But it can sometimes indicate conditions like PAD, hypothyroidism, or diabetes, so it's worth paying attention to. If your hair loss is sudden, patchy, one-sided, or comes with other symptoms like leg pain or skin changes, speak to your GP. And if you can't get a GP appointment and you're worried, you can contact NHS 111. Nothing in this video is a substitute for personal medical advice. Please speak to a qualified healthcare professional about your individual situation. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.